So how do we check for the passive fit? So actually I want to rephrase, because we don't want at this stage of the workflow, actually it's failure if you check for the fit only at this stage of the workflow. So the idea of total fit workflow is that you are constantly checking the accuracy, you're checking the fit, we do verifications, and at the end of the treatment, I can say that you mainly confirm the passive fit. So how do we confirm the passive fit? So here's the case with the full arch. We do initial screwing, not the final, of course, and we go from one side to another side. Don't screw all the screws on one side in one region. Same is done for the upper arch, and now in majority of these cases we have some pressure on the soft tissues, so we have to fight with that. And cotton roll technique is very good because patient is controlling, so the seating is done by the patient, and when we don't have pressure to the soft tissues, then we can measure better screw rotation. Of course, here upper and lower arch, and for the multi-unit abutments this angle is lower, so I look for 30 degrees. If that would be implant level restoration, 60 degrees or up to 90 is okay. So after applying final or close to final torque, we can check for the occlusion. And again, there are different strategies which articulating papers to use. So you can start from the thicker if you have more problems, and then end up with a thin articulating paper of 12 microns. This is the one I'm using in clinical practice, and the case is finalized. So in this case, we delivered the prosthesis without try-in appointments, following the total fit workflow protocol. But in cases that you are not sure, of course you can do try-in appointment if you want to check the occlusion, to modify it a little bit, and to have a shade selection, and then with the next visit you can complete the case. What else we can do? We think about biocompatibility, cleaned prosthesis, and additionally, of course, you can apply cold plasma treatment not only to the implant but also to the prosthesis. So we see here in this image that the surface became clean, hydrophilic. There are some other techniques, UV treatment of the surface as well. Because we have to think about peri-implant tissues, and peri-implant tissues, as you see here in one specimen that we made from the human gingiva, it's a living tissue, there are cells. Here we see the orientation of the fibers in the peri-implant tissues, so we want to introduce their biocompatible material. So for the single crowns, the proximal contacts can be challenging, and what we want to have good proximal contacts, nice occlusal contacts, and to finalize the case without try-in appointments. So by respecting those rules and being very careful and mindful at the planning stages, we are planning not only implant positions, we are planning prosthesis. We can be very efficient in providing various types of the prosthesis as it's shown here. But what is the problem? What the problem can you encounter down the road? Your digital workflow can be disturbed by change of the digital tools, softwares, devices, 3D printers. So you have to inspect constantly your digital workflow, be in good good contact and communicate well with a dental lab to observe of any changes. So this TFV inspector is used for this purpose. If you want to run a fast examination, fast auditing tool, how accurate is your digital workflow, you can try different intraoral scanners scenario, bite registration scenario, and test your prosthetic components for the repositioning. At the end, you get some simple report, and these superimpositions are done not by the human, but by the automatization process. And then you have the values for the distance between the scanned bodies, accuracy of the bite, and repositioning of accuracy of the prosthetic components that you are using. So with this, you are in better control which version of the digital workflow you want to use. So this brings us to the end. So once again, when we start planning of the treatment, we have to consider many aspects, many clinical, laboratory aspects, features of the implant systems, features of the digital tools, with this, we want to provide total fit of the final prosthesis.